Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Today, we'll be discussing about issues with regards to your cancer treatment, no? Especially during this time of COVID. So, as you well know, because of this COVID, our mobility is affected, and one of the problems also because of this is we tend to forget about other issues and other medical conditions that would be significant with regards to treatment, especially patients with cancer. No? So a lot of people diagnosed with cancer have a hard time with regards to helping or managing their disorder or disease. Okay, so today we've been discussing about some things that you can do in this time of crisis, so-called crisis because of COVID pandemic. No? So for patients, especially cancer patients, we have lots of issues with regards to how do they manage this at home. No? Kasi as you well know, it's hard to get out, hard to buy your food, right? Hard to buy your supplements or your drugs. So these are the things that it's a really big issue, and aside from that, it's also difficult in terms of the financial status, because of course a lot of people, if they cannot go out and work, of course they're also financially strained. So these are some of the issues that we have to address. So I guess number one would be how to take care of yourself. So even during this time of crisis, we should not forget, especially cancer patients, we should not forget about to taking care of ourselves. So the number one thing that we have to do in taking care of is really make sure that we have enough exercise or movement. So you don't really need to go to the gym, you just need to make sure that you walk. You can walk, in your house, several flights of stairs up and down. That's one way of exercising, making sure that you have enough blood circulation, as well as just to keep your muscles in proper order. Because if you don't exercise, we start losing a lot of our muscle mass. So the less muscle you have, then you will have problems later on, because then you will develop more problems with regards to nutrition. So even if you're eating enough food, enough protein, but you're not doing your exercise, you will definitely lose your muscle mass, which we don't want to happen. Okay? So secondly, for cancer patients who have problems with regards to their supplements right now, so it's hard, but thankfully we have online shops wherein you can still get your supplements without leaving the house. So just not forget to take enough vitamin C. Okay, for cancer patients, you have to take at least 5 to 6 grams of vitamin C. If let's say you don't like to take capsules or pills, then you just take a bit of calamansi, maybe 30 pieces of calamansi, lemon or dalandan. So all these have high vitamin C, or maybe your guava, it also has high amounts of vitamin C. So you don't need to take 30, 40 capsules or tablets of vitamin C. You can make a juice and still get enough vitamin C into your system. No? Now, vitamin D, very important, not only for cancer patients, but also in this time of a virus, a pandemic, because your vitamin D is a very good immune modulator. No? So your vitamin D helps in improving your immune system. So if you have enough vitamin D, it actually boosts your immune system. This has been shown, in so many studies already. We're not talking about hundreds of studies, we're talking about thousands of studies showing that vitamin D not only help and prevent infection, it also can help in extending your lifespan, especially among cancer patients. Okay, so how much vitamin D you're supposed to take? For cancer patients, normally we would ask them to take around 5,000 units a day. So that's 5,000. So normally you get your vitamin D supplements in the 1,000 or 2,000. So that would not be enough. If you have no sickness, you're pretty healthy, then 2,000 of units of vitamin D is enough. But if you're diagnosed with cancer or any chronic diseases, then you need at least 5,000, no? For those who are really very sick, so they might have to take up to 10,000, no? So there are other doctors specifically in Brazil, wherein they give as high as 100,000 of vitamin D every day. But of course, I wouldn't suggest you doing that, because that would be too high, and then you really need to have your blood checked to see if your vitamin D levels is good enough or adequate enough. So 5 to 10 is pretty safe. Okay? So next would be, aside from vitamin D, of course, in this time of COVID, you can also take a bit of zinc. Okay, so what foods are high in zinc? Your nuts. Okay, a lot of it are really in your seafood, but of course, in cancer patients, seafoods are not really ideal. You may have fish, but seafoods are really not advisable for cancer patients. So zinc, and then selenium, also very high in your nuts, your beans, your mushrooms. Okay, fresh ones, please. Do not buy your mushrooms from packed in cans. They are not so healthy. So we want to make sure that we get the right amount of nutrients in sources wherein we know it's safe and free from pesticides, antibiotics, or toxins. Okay? And then aside from your vitamin C, your vitamin D, your zinc, your selenium, I think what's also needed to boost your immune system is also some mushrooms. Okay? So you may have mushrooms, fresh or dried. Just avoid those that are in cans. Okay? So what type of mushrooms? Even your white bottom mushrooms do have some effect on your immune system. You can have your shiitake mushrooms, very nice. Your what we call the long white mushrooms, what we call the oyster mushrooms. So these have a very beneficial effect on your white blood cells or immune system. So again, for cancer patients who are holed up at home, you cannot do anything. So make sure that you get enough nutrients, vitamins, minerals. Okay, so vitamin C, vitamin D, your zinc, your selenium, your mushrooms. Okay, so if you can get a bit of omega-3, that would be nice also. One way of getting omega-3 is you don't have to buy the expensive, salmon, sea bass, or tuna, which are also very high in mercury, so you can get those high fatty fish, high in omega-3, like your sardines, your mackerel. They're high in omega-3. Just make sure that they're not in the can. You can buy the bottled ones. I think they're way more tasty. It doesn't have that metallic taste, and they don't have that lining, because all these canned foods, they're lined by BPA. So your bottle doesn't only have BPA. Even your canned foods, they are lined with BPA. So we have to avoid them, because they can cause cancer or make your cancer even worse. So we have to make sure that we're getting enough omega-3. So you take your sardines or your mackerel. Other sources of omega-3 would be not really omega-3. How you can also take flaxseed oil. Very good, especially for patients who are diagnosed with cancer. Okay, so now one of the supplements that I think that is underrated, especially in this time of crisis, is turmeric. Okay, turmeric is a very good anti-inflammatory, a very good antioxidant. Okay, so but a lot of people have problems with turmeric. Sab Bernales is asking if she could take supplements even though she has GERD. Actually, you can take your supplements even though if you have GERD. You just make sure that the supplements you're taking will not aggravate your GERD. So what is the top supplements that would aggravate your GERD is actually turmeric. No? So if you're taking turmeric and it gives you stomach ache or a lot of gas, belching, then maybe you have to avoid it in the meantime while you're still having problems with your GERD. So if you have GERD, then I think one supplement or herb that would be of benefit would be your aloe vera. Okay, so there are aloe vera juices out there. Of course, we don't want to get aloe vera that are very sweet. Okay, but there are aloe vera juices out there that has, you know, less sugar, so that would help you with your GERD. Okay, so I do get a lot of questions with regards to cancer patients because they're afraid of going to the hospital or to the laboratory, especially because of their cancer. But again, if you have cancer, you have not seen a doctor or been having your blood test done, and you know that your cancer is active, make sure that you do have your blood check. Okay, so if you're afraid of doing your blood check in the hospitals, I'm sure there are a lot of laboratories out there that can do the test for you. Okay, some of them even you can do home visits, right? So you don't have to go out the house. They come to you, get your blood extracted, and you know, you don't need to do really anything except put out your hand or your arm for blood extraction. So make sure you have your blood check. Okay, now some hospitals are still having issues with regards to their clinics because some are still not allowing doctors to open their clinics in hospitals, again because of this COVID problem. So if you do have problems and you know you are worrying about it, you can still call the hospital, get the number of the doctor so you can get proper guidance and monitoring for your disorder. Because sadly, you know, because of this COVID problem, we've been having more patients who come in that are sicker, you know, and the only reason they're sicker is because they couldn't get help as early as possible because of this lockdown. But now we're not in lockdown, so I think we have to make sure that we see our doctors, you know, have your body check, your tumors markers, your blood markers checks, just to make sure that you're still okay. Now I will read some questions from our listeners and answer them in this segment. So Miss Anna is asking for HER2. So she's saying that she has breast cancer that is HER2 new positive. Okay. So normally patients with HER2 new positive, they're given what we call Herceptin. Also, they're given tamoxifen. So one alternative to that would be flaxseed oil. Okay, patients taking flaxseed oil seems to be of the same benefit as those taking tamoxifen. As you well know, patients taking tamoxifen are at higher risk for uterine cancer. So a lot of women have to do annual checkup with their OB just to make sure that they're not developing uterine cancer. So one way to avoid uterine cancer is just, you know, take flaxseed oil. Okay. Miss Mabi is asking, get rid of side effects from certain conventional medicine. Okay, so the best way to get rid of side effects is to avoid taking the medicine, right? So the best way is really avoiding the drug that is causing the side effect. Anna is asking, what is the food that should take before and after chemotherapy? Actually, if you're going to do chemotherapy, the best way to avoid any adverse or side effects from chemotherapy is to avoid eating carbs. So let's say one day prior to chemotherapy, at the same time, try to avoid carbs. So that on the day of chemo, okay, patients who did not take carbohydrates, zero carbohydrates for the 24 hours prior to chemotherapy are less likely to develop adverse effects or side effects. Okay. At the same time, if you're into juicing, you can also do that. You can do juicing 24 hours prior to chemotherapy, just to avoid side effects. But of course, if you're going to do this, make sure that you ask your oncologist, because your oncologist might not be so happy if anything happens to you during your chemotherapy. So always ask your oncologist if you want to do something, you have to change your diet prior to doing chemotherapy. Okay? So Miss Sab is asking again if she can take vitamin D and fish oil supplements for GERD. Yes, you can, but make sure that you're gonna take in your vitamin D and fish oil. You make sure you take it after eating, not before meals. Okay, so that you won't have digestive problems. Okay. So a lot of these, supplements like vitamin D and fish oil, because they're fat soluble or lipid soluble. So you have to take them after meals, not before, to avoid any digestive issues. Okay? So Miss Lori Landico is asking any advice for hypothyroidism. So if you have hyperthyroidism, if you're taking thyroid drugs, another way to improve your thyroid hormones would be to take in seaweeds, okay, as well as avoid fluoride toothpaste. Okay, yes, fluoride toothpaste. Fluoride decreases your absorption of iodine. So one way to increase your iodine absorption is actually avoid your fluoride toothpaste. Anyway, fluoride is a neurotoxin. Okay, so we avoid fluoride toothpaste. Use a non-fluoride toothpaste and take in your seaweed, especially those who are diagnosed with breast, ovarian cancers. You have to take in lots of seaweed. Okay, so yes, is it recommended to take in probiotics if you have GERD? Oh, definitely. You may take GERD. There are some studies showing that certain probiotics do have an effect on GERD, or what we call the hyperacidity, or gastroesophageal reflux disease. Okay, so how would you know you have GERD? Then, after eating, you keep on burping, you have so much gas in your stomach, having hard time breathing, so you might have GERD. Or you have this cough that seems to be persistent, doesn't go away, especially when you lie down. So that could be a GERD problem. Okay, so Laura is asking any supplements to be recommended supplements for those who have COPD and cancer. She's asking any contraindication. Actually, there are no contraindication to taking supplements if you have COPD and cancer. One of the supplements that would be very good for those who have COPD would be N-acetylcysteine, as well as glutathione, because they help in removing or dissolving the phlegm or secretions in the lungs. So one supplement to help with that COPD would be N-acetylcysteine. Or I prefer N-acetylcysteine, because glutathione, anyway, if you take glutathione, it your stomach acid will break it down to N-acetylcysteine. So might as well just take N-acetylcysteine and let the body convert N-acetylcysteine back to glutathione. Okay, I think one of the things that people are not aware of, or a lot of people, I would say even doctors don't know this, especially for those who have COPD and cancer, or they have upper or lower respiratory tract infections, nebulizing hydrogen peroxide. Okay, I'm sure you know what is hydrogen peroxide. Please don't go buy your hydrogen peroxide in the chemist or in the drugstore, because some of them do contain a lot of heavy metals. So you have to buy food grade hydrogen peroxide, and you can use that as a nebulization, but you have to make sure that you mix it. So for 1 part of hydrogen peroxide, you add in around 3 parts of water, so that it won't be too much irritation in your upper airway tract or your throat, because it can dry up your throat. But I tell you, a lot of people, including me, have tried doing hydrogen peroxide nebulization. It's not only good in killing your bacteria, viruses, and fungus in your upper respiratory and in your throat. It's also very good as a prevention in letting other viruses, bacteria, and fungus into your system. Okay, last question before we go. What supplements to prevent the recurrence of cancer? Oh, that would be a very long list. But I would say the best and the most cost effective is just to take lots of different green vegetables. All the vegetables, whether it's green, violet, orange, red. So the more different vegetables, the better. One specific supplement or herb that I really want you to take would be turmeric. Okay, because turmeric is an excellent antioxidant, anti-cancer, anti-everything. So that's, I think, one of the most cost-effective herbal supplement in preventing the recurrence of cancer. So where do we get food grade hydrogen peroxide? There are places wherein you can buy online food grade because they use food grade hydrogen peroxide to disinfect food. So they sell it in gallons. Okay, so it's not too expensive. But if you really want to get good quality hydrogen peroxide, please don't buy it in your ordinary pharmacy because they have high amounts of heavy metals, specifically tin and platinum. And all these they're not so good. Okay. Somebody's asking stem cells. If you're diagnosed with cancer, we avoid taking stem cells because these stem cell supplements may in fact increase or stimulate more cancer growth. Okay, so thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.